I'm cancer physical therapy specialist, Dr. Leslie Walke. Welcome to the Recovery Room. Today we are hosting a quiz for breast cancer survivors to see how much of a smarty pants you are. Are you ready? Because here we go. Question number 1, yes or no? Must a person with a stage 3 breast cancer have a mastectomy? Number 2, yes or no? Is a person diagnosed with a stage 0 breast cancer always offered a lumpectomy? Question number 3, yes or no? Can you determine the stage or severity of a person's type of breast cancer by whether or not they have radiation? And our final question, number 4, yes or no? If you are diagnosed with breast cancer in one breast, does having a double mastectomy decrease the risk of recurrence of that cancer? Okay, got your answers in your head? Let's see how you did. Question number 1, must a person with a stage 3 breast cancer always have a mastectomy? The answer is no. The determining factors for the type of surgery are most often the size of the tumor and the volume or size of the breast. So even if a person has a stage 3 tumor, if their breast is large enough that the surgeon can surgically remove all of the tumor and a clean margin and still have a good cosmetic outcome, a lumpectomy or partial mastectomy is a safe option. Remember, a lumpectomy plus radiation has similar survival outcomes compared to mastectomy. Question number 2. Is a person diagnosed with a stage 0 breast cancer always offered a lumpectomy? The answer is no. Often, stage 0 breast cancer, also known as ductal carcinoma in situ or DCIS, is found scattered in different quadrants or locations of the breast, requiring the need for a mastectomy. Question number 3, can you determine the stage or severity of a person's type of breast cancer by whether or not they have radiation? The answer is no. Regardless of the stage, nearly everyone offered a lumpectomy will require radiation. Radiation is routinely used after a lumpectomy to kill off any microscopic cells possibly left behind after surgery. So stage 0, stage 1, stage 2, stage 3, if you've had a lumpectomy, you will have radiation. And finally, question number 4. If you are diagnosed with a breast cancer in one breast, does having a double mastectomy decrease the risk of recurrence of that cancer? The answer? No, it does not. What decreases the risk of recurrence for the current cancer is the surgery on the involved breast, followed by the other treatments required like radiation or chemo, based on the type and stage of that cancer. Removing the healthy breast with a bilateral mastectomy provides no protection against recurrence from the cancer you already have. However, a double or bilateral mastectomy will prevent a future or new separate breast cancer. In some rarer types of breast cancers, and in the case of a person with a known BRCA1 or 2 gene mutation, there is a significant risk of developing a new unrelated second primary in the other breast in the coming years. In these instances, the surgeon will recommend a bilateral mastectomy at the time of diagnosis. But again, this does not impact the risk of recurrence of the cancer you already have. So, how'd you do? Are you a master smarty pants? No matter how you scored, I hope you learned something, because the more you know and the more you understand, the better decisions you can make. I'm Dr. Leslie Walke signing out from the Recovery Room. We'll talk again soon.